I'm looking at you or the camera?
Just conversation. You can look at me, look at the camera. You can treat that as if it's like a third person conversation.
Okay. A couple of looks. Bones.
Hey guys, welcome back to Scanning the Mind. For those who don't know us here, I'm Varun, I'm a radiology trainee in the UK. We're here for another one of our medical journeys, and today I'm very lucky to have my good friend, Mr. Hussam Ahmed, who is an orthopedic surgeon working in the UK. Thank you for coming on.
No, thanks for having me.
So, could you take us through an average week in the life of an orthopedic surgeon?
Yeah, sure. The best things, each week's varied. It normally consists of 2 or 3 days of theatre and maybe 1 to 2 days of clinic. And that's a week where you're not on call per se. What happens in specialty training here in the UK is you have 6-month rotation between different subspecialties. So I'm on upper limb at the moment. So my operating lists will be with arthroscopy scopes or arthroplasty procedures or joint replacements, and the clinics will be predominantly upper limbs, so shoulder and elbow clinics. So it's quite nice, you get into a bit of a routine, you get used to the presentations and you work through, and it's nice having that variety. Not each day is different, and that is very cliche, but it is true.
Yeah.
Scattered within that is on-call commitments, so just like most of the specialties we do on calls, and that can be very varied. So you can either be on call during the weekends or weekdays or even night shifts, which I hate.
You got nights next week, haven't you?
I am, yeah, just pray for Hussam, please. But that also, when you step back, you learn a lot on those on calls. You have to make a lot of decisions independently. Yeah. You do a lot of operations that are urgent, of course, and they are rewarding. So the variety is excellent. It can be fast paced, it can be busy. Often feel like we work maybe longer hours than some of our colleagues, but again, it's part of the trade-off. We keep coming back to the same thing.
Yeah, you definitely work longer hours than me. I remember you. What time do you go into work for?
So normally get in for about 7:30.
Okay.
20 past 7.
So that's to consent patients, I'm guessing.
Yeah. So starting time is 8. So you go in, see the patients early, consent them, make sure they're all ready for theatre. Then go to what we call the huddle or the brief, which is where the theatre team for the day meet, talk through each case, what we need to do, patient positioning, kit, the anaesthetic side of things, and then you just work through the cases. But that'd be a typical operating day per se.
Okay, fine.
Clinics maybe start a bit later. Possibly.
Okay. Yeah. What parts of your job do you really enjoy? What parts of the job made you think, oh, this is what I want to do for the rest of my life?
Yeah, I think it's the variety of the job really. Some days are hectic and fast paced. Okay. Some days can be quite relaxed, and that can be just equally as rewarding and as nice to do, really. Obviously, you have to enjoy operating. If you didn't enjoy operating, it'd be a pretty miserable time, really. Fine. I mean, not every operation is hugely enjoyable, especially when you're learning something new. It can be quite frustrating, but ultimately you do get a rewarding feeling from that. But I think also kind of from the clinic side of things, kind of helping patients and seeing the improvement between when you first meet them and the second and third time you might meet them, and that is quite rewarding. So it's more than just the operating, I'd say. So
it sounds like you really enjoy your job.
Yeah, I do.
If you had to pick one thing that you really enjoyed, the best thing about orthopedics for you, what would you say?
I think, at our stage, so I'm what we call it a junior registrar. I think developing operatively, I think ultimately you do surgery for surgery, and then for instance a procedure where a few months ago you might have really struggled with, where now it's something where you're very comfortable with, and you feel like you're doing it in as best as you can. Yeah. And I think just constant development. I think from a patient side of things, I think it's honestly just seeing them maybe a few weeks after an operation and them thanking you and then helping in their day-to-day life, and that is really rewarding.
Even though you really enjoy your job, no job's perfect. Not even
orthopedics,
not even radiology.
It's close.
What do you not enjoy about your job?
You maybe have to do a lot of things that you don't want to do to kind of keep pushing through that conveyor belt, whether that be audits and CV building things as part of the curriculum getting through, or even often we have to move between hospitals every 6 months, and just having to readjust, get used to a new team, then get used to you, that feeling to impress, which is important, but sometimes it's nice being comfortable within a team for a short while. So that constant changing, but again, that's not specific to orthopedics per se. I
think it's more in procedural specialties though.
Yeah.
Because at the end of the day, if a consultant is going to trust you to operate on a patient who has their name on it, they need to be very comfortable with you.
That's understandable, isn't it?
And also, I don't think a lot of people realise each surgeon does things differently.
Yeah, very, very differently.
So
that's probably another thing actually. Like getting used to, you operate with 3 people in 1 week, and each day is just completely different. But it's good because then you learn different things from different people as well.
Yeah, one of the things that I remember somebody saying to me is it's good to work with a lot of different types of people because you pick up from each person what you want to do.
Yeah, that's good advice.
And
yeah,
equally,
definitely.
you pick up things that
you don't
want to do. So you said you kind of thought at the end of F2 that maybe orthopedics is something I want to do. Did you know from medical school, or when did you when did that idea enter your head?
I think I did. I think it's that cliche, isn't it, of enjoying sports and kind of you do gravitate towards kind of musculoskeletal side of things at medical school. Yeah. You get more of an interest to that, and then you start to develop a bit of an interest. So we had student selected components at university. Did an orthopedic one in that as well. And again, every time I've done orthopedics throughout the time, I did enjoy it. And I've been inclined to do another rotation or another attachment. And I've always enjoyed it, really.
So you said when you're a sports person when you're younger, you sort of gravitate towards the musculoskeletal system med school. If there's sort of people who are kind of like that watching and they think, oh, you know, I'm like that, but I don't like operating necessarily, what other things would you kind of consider?
There's multiple aspects to musculoskeletal medicine and surgery. There's the rheumatology side of things, which is a more medical-based specialty, and I know you've had videos on that before.
We'll link it up here.
Yes. And that can be more the medical side of things and medical management, and that can be rewarding. And sports medicine is something that's growing as well. I think now they have specific training programs for sports medicine, or going via the GP or the medical route and being attached to some kind of sport and affiliation and working directly with sports. That can be quite interesting as well. You don't have to operate to work within musculoskeletal medicine / surgery. I think you can try and find what works for you, really.
So for those who aren't familiar, can you briefly explain the training pathway to become an orthopedic surgeon?
We briefly touched on foundations, so F1, F2, and then you're at a point to apply for core training, core surgical training specifically. And I think, as you've touched on previous videos, core surgical training will have specific themes. You'd be more inclined to do an orthopedic themed core specialty training, so that'd be 2 years where normally 12 to 16 months of that 2 years will be orthopedics, and you might cover vascular, plastics, general surgery, that type of thing. Following CT1 and CT2, then you're at a point to apply for registrar training, so another application process which can be quite stressful, to be honest. That's probably a bit of a bottleneck, and you kind of you're aware that everyone's working towards the same goal, and then from that point you'll be ST3 and working through to ST8, and then you'll be at the point where you can think about fellowships before consultancy.
I remember when you were applying for ST3 jobs, you were always doing research and publications and this course and that course, because like I said, there is a bottleneck to get into ST3, and obviously you smashed it and you got in first time, but I know people who've been applying for ST3 numbers for 2, 3, 4 years and you don't get in, so you do have to be very focused.
Yeah, and I think it's as I mentioned, it is pressure, and anyone that says it isn't would be lying. It kind of reinforces the fact that you really have to enjoy it and want to do it, because there are some aspects with any job which you don't enjoy, and having to pad your CV out can be quite mundane and boring, but you got to remember what you want to do, what you want to be, and hopefully that can push you forward. In
terms of plans for the future, so most surgeons in the UK are very specialised. What type of specialties or subspecialties are there in orthopaedics, and what do you think you might want to do?
I'm on upper limb at the moment. And that could be often you get shoulder and elbow specialists or hand and wrist specialists. Hips and knees kind of go together as well. Foot and ankle goes together, and spine as well. But within that you can develop even a further specialty. For instance, some people prefer soft tissue work, so kind of soft tissue knee work, soft tissue shoulder work.
Sorry, by soft tissue do you mean like meniscal tears?
So a lot of procedures, kind of sports related injuries. Fine. Yeah, so meniscal injuries, ACLs, MCLs, and a lot of work, camera or arthroscopy work. In terms of what I want to do, I think it's early to say.
So orthopedic surgeons, we mentioned the stereotype briefly at the beginning. A part of the stereotype is they're very rich. I think that stems more from America, where they are, I think, one of the, if not the highest earning specialties. But even in the UK, there's a bit of a stereotype like, oh, orthopedic surgeon must drive a nice car. If somebody tells me they're an orthopedic surgeon, I'm looking at what they're driving. Why do you think that's a stereotype? And do you think there's something behind it?
Well, I think there's definitely a lot of scope for private work, isn't there? I think there's always going to be orthopedic work. If you think there's always going to be arthritic patients that need joint replacements, and the private sector can be a machine for that type of work, as well as other type of orthopedic work as well. I think orthopedic surgeons are often hard workers, so I think they end up being high earners because maybe they push beyond certain levels as well. I mean, I don't have the stats off the top of my head. There probably is a high proportion of people doing private work because it's there, but again, I think people assume that's very easy to get into. Obviously, it's early for me to know that, but that's a very hard side of things to push into as well,
Yeah.
because there's a lot of competition. So the guys that are really pushing and doing well with that are people that have really worked hard to get to that position as well.
And I think a lot of lay people think, oh, you know, NHS doctor working privately.
Yeah.
I think they often think you're working. You go to hospital, NHS hospital for a couple of hours in the morning,
Yeah.
and then off to the Spire to do my private list. It's not like that. So you have to work at least 40 hours a week,
Yeah,
or 37 to 40 hours a week for the NHS, which is a full-time job.
yeah, basically, yeah.
Most of them then work more than that for the NHS. And then in their evenings and weekends and whatever, they're going to the private hospitals.
Yeah, so I know some of the consultants that I work with, they'll do a couple of evenings a week of clinic and maybe 1 or 2 lists a week as well, extra. So it's kind of high input, high output.
Finally, Hussam, any advice for any aspiring orthopaedic surgeons out there?
Yeah, I think if you're maybe a medical student or a foundation doctor and you're thinking about it, I'm biased as they come, if you haven't noticed already, but I would really recommend it. You can go down multiple avenues. Each week is different, each day is different. The team side of things is really good as well. I think the medics of you may be aware that there is a stereotype in orthopaedics, and I think that did stem from somewhere in the past, but I've honestly never seen that, and no one's paying me to say that, don't worry.
Someone just slipping you a bit of money.
I mean, I'm welcome to, I'm trying to move house. But it's, I've worked with great teams, great consultants, great nursing teams, theatre teams, and it really is a nice environment. The consultants that I've worked with are really interested in teaching you, developing you, and I think when they see that you have an interest and you show enthusiasm and endeavour, then I think they push to kind of make sure they repay that to you. Yeah. I think it does work quite nicely. In the year that I'm in, I think there's more females than males
really?
in the ST3 group. So if that's something that puts you off, then I don't think that should do, hopefully, and hopefully you're starting to see that in the orthopaedic teams in different hospitals. I think the job satisfaction is high. It is maybe a bit of a longer road than some other specialties, and that's a trade-off, so be aware of that.
Well, Hussam, thank you very much for coming on.
Oh, thank you.
Yeah,
it's been fun.
It's been a pleasure.
But I lived with Varun for 5 years. So
we're going off script, mate. This is not on the script.
If anything you want to know,
this is not
I will let you know.
I've built this image on Scanning the Mind. I'm a humble radiologist.
I know a very different Varun.
See you later, guys.
Bye.